Tobago's COVID-19 vaccination rollout plan. And my guest this morning, it's via Zoom. It's Dr. Roxanne Mitchell. And Roxanne is the General Manager of Primary Care Services at the TRHA. Good morning and welcome.
Good morning. How are you?
Doing quite well. Thank you for joining us this morning. And let's discuss the vaccine rollout. Now, in a recent press conference, the Prime Minister would have given out some information. And we want to know, what is the means by which and what is the plan that Tobago is going to take via the TRHA when it comes to administering the vaccine to those who are scheduled to do it and when?
I'm not sure I understand. We have begun our rollout.
Right.
We started on Saturday. We would have received 200 doses from the stock that came from Barbados. With that, we will be vaccinating 100 persons, 100 healthcare professionals, frontliners. So we did begin that process on Saturday. We'll continue that process this week as we run through our delivery mechanism going forward.
And
sorry.
No, yeah, sorry. Yes, so just enlighten us a little bit on the process and how it has been undertaken thus far and what the plans moving forward.
Right. So with regard to the administration of the vaccine, it went smoothly. We have been able to scale up in terms of the number of nurses administering the vaccines. On Saturday, we had four DHVs that were willing to administer the vaccines to persons. We were limited then by the number of persons presenting for the vaccine, because persons would have had previous engagements. What we're going to do going forward is to send out another call for persons who would have missed Saturday to be able to come forward later this week to receive the remainder of the vaccine.
Right.
Beyond that, we are waiting the national quota. Once we get our quota from that, we will begin to scale up with regard to vaccine administration. Later this week, you will find that we're sending out the pre-registration forms for all persons interested in taking the vaccine. We're asking persons to complete those forms and submit them. We will give you the information as to where you can submit so we could begin to prioritize and we can begin to administer the vaccines. So you'd find that persons may be called up from different groups, called up sooner rather than later.
And that would be good news for many. But, there's still some fears by the general public and those who may not be fully informed of, the vaccine, how vaccines work, how they were able to create a vaccine this quickly. And some are purporting that, the vaccine may have foreign agents in it for, very different things. There's some are saying, is the mark of the beast and all like that. What is the TRHA doing to allay the fears of the people who may be apprehensive to take the vaccine?
All right. So we're starting, first of all, with the media campaigns. In terms of the media caravan, I've been appearing on a number of programs. We will also have other persons that will be appearing on a lot of media programs. We then will move into community engagements. We will be speaking to the different groups. So be it the essential services, be it church groups, be it village councils. We will then be moving out into the community to speak to persons with regard to their fears, apprehensions, and just general information sharing with regard to the vaccine. We would also be sending out flyers, information on our websites with regard to the information as well.
When the country gets its, first allotment from the COVAX facility and Tobago gets its distribution as well, when do you believe that there would be challenges when it comes to the technical side of disbursement of the vaccine to the masses?
The only challenges I can see going forward would be if the public does not step forward to receive the vaccines. Oxford AstraZeneca can be stored between 2 and 8 degrees Celsius, and all the vaccine refrigerators within primary care, both in Trinidad and Tobago, can store vaccines, they hold vaccines actually between 2 and 8 degrees Celsius. So as far as that part is concerned, we should have no issues. With regard to our nursing personnel who actually deliver the vaccines, they've been doing this. This is their bread and butter. If you go back to Alma Ata, if you go back to Gobi in terms of pulling out aspects of delivery of healthcare to all, emphasis was placed on immunizations so that our nurses are very well trained with delivering the vaccines. We are putting things in place with regard to scaling up as required. And as was said with the national plan, if there's a need to have mass vaccination sites, we would also bring those in according to the needs of the population.
All right. I want to thank you so much for your time this morning, Dr. Roxanne Mitchell, and giving us this wonderful information and, you know, giving us an idea of the plan for Tobago as it comes to the rollout of the COVID-19 vaccine, which has already started. So thank you very much, Dr. Roxanne Mitchell, General Manager there in Tobago with the TRHA.